Hi everyone, it's Sophie. I'm the osteopath at Perfect Balance in Fitness First Aid Albans, and I am joined today with.
Hi, I'm Jenny, and I am a sport therapist also at St Albans and in the Hatfield Clinics.
Yeah, so today we are going to be talking about something called frozen shoulder, something some of you may have heard of before. The other term or name for frozen shoulder is adhesive capsulitis. It's the fancy anatomical name. And so we're just going to talk about what it is, how some people get it, why some people get it, the treatment that we can do for it, and some things that you may be able to do yourself at home to just help with frozen shoulder, because it is a bit of a pain.
Yes, I think the main characteristics of it is the restricted movement. A lot of people come in and they have some sort of restricted movement in their shoulder, and straight away they're like, oh, it's not this frozen shoulder, is it? And typically the pattern of it is the gradual decrease in range that you can have in the shoulder, and it can get so bad sometimes. I've seen people that literally cannot move at all. But yeah, what kind of symptoms do people usually come and see you with? Because I know you've had quite a few.
Yeah, so I, more than anything, I know I was first get the stereotype of only seeing low back pain, but I normally only see shoulders. So I've got quite a few patients who have frozen shoulders, and I've treated them for that, and we've gone through a full course of treatment, and now they're much better. But the main symptoms is obviously the restricted range of movement. Now, there are different things in the shoulders that can cause that restricted range of movement. It's not just frozen shoulder. So when people Google it, and they come in and they go, well, I think I've got frozen shoulder. And sometimes it isn't that. There are lots of different things that can go wrong in there. But one of the main characteristics is that you can't do this movement. So you can't open your arm up like this. Or when you do move your shoulder, you're moving your entire shoulder when you try to lift it up like this. So you're almost bringing your shoulders to your neck just so that you can do some kind of movement. There's no movement just from the arm and the shoulder complex.
A lot of people do also kind of come in and they say, I've had this shoulder issue, it's been progressively getting worse, my movement's been getting less and less, and now I've started to develop a neck issue. And that's because, as you say, a lot of people are starting to recruit these muscles instead of their shoulder, and obviously that then starts affecting everywhere else.
Yeah, exactly. And a lot of people, when they come in and they've got really quite bad frozen shoulder, as in it's pretty far down the line of symptoms, they won't even have pain there when they use it. It's just like, well, this is just all that I can do. Whereas some people, if they're suffering from, a tendonitis or a rotator cuff impingement, or something along those lines, it will actually be painful. So sometimes when you do have a frozen shoulder, it's not even painful anymore. It's just physically you can't move it at all, and then it can actually go to the other side as well. So it's pretty common to have what we call bilateral frozen shoulder, and then you can see some people, when it gets really bad, they can physically just have their arm all the way up here. But I'm luckily never seen a case that is that bad.
No, me either. There's there's like there's kind of loads of different evidence research on why people get it, who get it. It's all a bit of a blur, really, isn't it? Some people come in and they're like, I think I fit into a certain category, or what's kind of your typical people that you see that come in with it?
So it tends to be middle-aged people, but I have seen it in someone who's in their 20s. Diabetes also seems to be a factor. It doesn't matter if it's type 1 or type 2. That does not mean that everyone with diabetes will develop frozen shoulder, but it does seem to be a characteristic of it. More susceptible to developing shoulder problems. Sometimes they have very active jobs, so they use their shoulders a lot. So you get a few contractors or labourers or people who are very desk-based all the time, and they work quite long hours, and they're in one solid position for many hours of the day. Lorry drivers as well. But again, it doesn't follow a specific sort of line of symptoms of why somebody may get it. And sometimes it can just start off as a little niggle and ignore it, and then all of a sudden, oh, actually, move my shoulder.
Yeah, I've had it in quite a lot of people where they can kind of recall back maybe a few months previous where they remember hurting their shoulder, it being a bit niggly and then it getting better. And then kind of frozen shoulder is developed afterwards, almost like a secondary problem. And also there's kind of the role of maybe hormones that are played in kind of scar tissue laying. So I think it's women over, usually in women over the age of kind of 40s, 50s, isn't it? Post-menopause.
Yeah. But again, you can develop it in your 20s as well. I've seen some people after they've sustained some, I wouldn't say serious shoulder injuries, but they've landed on their shoulders. I've had one in particular who I saw for a while, who he just sort of fell over when he was skiing and just sort of landed on his entire side. And that was a bit sore and a bit painful. And then you don't really want to move it too much because it's a bit sore and a bit painful. And then all of a sudden, when you do go to reach the top shelf of the cupboard, do a movement that you wouldn't normally do every single day, you go, oh, actually, this is as far as I can go now. But again, it may not be absolutely agonizing pain, which is why it can creep up on you. And you may go, oh, okay, well, I can't reach that top shelf, but I can do it with the other hand, so it's fine. And then what normally happens is they'll come and see me and they'll go, well, I've had it for 8 months now, and this is as far as I can reach my arm up, and this is as far as I can go back. And that's when it takes a long time to sort of reverse.
Yeah. There's almost like a pattern that frozen shoulders follow, isn't there? There's a lot of people, when they Google, they come in and they talk about these 3 stages of frozen shoulder. So you've got the freezing, the frozen, and the thawing. And so freezing is the initial, you've maybe had an injury, it's something that's coming on, you're noticing that your movement is getting less and less. Your frozen stage is where you're at your worst range of movement. So everything's really, really stiff, hardly any movement. And then you've got the thawing phase. So for some reason, everything starts getting broken down, the scar tissue starts getting removed from the shoulder, and your range of movement comes back until you're kind of fully recovered.
And it can happen quite quickly, actually. So it can... the initial stages, it can take a little while to just break it down, and the treatment itself can normally be quite uncomfortable because you're touching and moving things that do not want to be touched and moved. They want to stay that way. It's almost like the muscles have become cement, and you touch them and you're just like, oh, this is rock solid, this pectoral muscle, and you try to move it, and you're doing things that can cause a little bit of pain and discomfort in the initial stages of treatment. But after, I would say, the first few treatments, first several treatments, you then all of a sudden go, wow, I can actually reach all the way up here now, and it can happen quite quickly. But it's basically making sure that it then doesn't go on to the other side. And it's then trying to get it better 100% rather than only getting it 80%. Because that is what can happen, is that lots of people then go, well, I'm better now because I can almost do everything. And then it can, in fact, reverse a little bit as well. So you want to make sure that with a frozen shoulder, you're solving the problem 100%, so that then it doesn't go back to how it was before. Yeah,
I think also, so you do have, in some people, quite a quick recovery from it, but then on the flip side you can have a long recovery. And I think for me, I see the people who take longer to recover as the ones that took longer to come in and get it dealt with, really. And also maybe the people who, as you say, get 70-80% and then think, oh, I'm in the thawing process, it's just going to continue to get better, I'll leave it now. But again, it's the treatment and the rehab and the strength and the range of movement stuff needs to be continued, as obviously you say, you don't want to take a step backwards.
Yeah, 100%. And even if you do make it 100%, there are those few small percentage of individuals who then can actually develop it again. You can just be more susceptible to developing it again. And I've seen a couple of those patients as well, but they can normally see the signs pretty early on. If you've had really bad frozen shoulder one time and it's taken you a year or two to finally go back to that full range of movement, and you can play golf with a full swing, you can play tennis, you can go skiing, you can do jogging and reach the top of the cupboard shelf, and then all of a sudden you do that one more time, that's not a good sign. And so they do come back in again, but it's getting it at the early stages so that basically we can get you fit and fighting as soon as possible, but also stopping it from getting any worse.
Yeah, so obviously we've spoken now quite a bit about kind of what it is and the process that it follows. I think a lot of people maybe don't understand it because you've got your standard kind of muscle strains, your ligament injuries, and they don't understand what actually is frozen shoulder and what is happening under the skin. It's all about the laying down of the scar tissue, isn't it? So if you've got your shoulder joint, which is a ball and socket joint, which allows for increased range of movement. What happens is a lot of scar tissue starts getting laid down in that joint, which means that it becomes a lot more harder to move. When you do have injuries, so muscular injuries, tendon, ligament injuries, scar tissue is also laid down. But obviously it's more excessive within frozen shoulder.
Yeah, so I think you might even have a shoulder model there in the room with you. Shoulders are in fact rubbish joints. Shoulders are a very badly put together joint, as you can see there. So it's basically just 3 bones that are sort of there in a triangle shape with the arm coming down, just with a mass of knot of ligaments and tendons on top, trying to just hold everything in place. Now, if everything is running smoothly and perfectly, you can see almost like the little holes in between the little ligaments, and you can see a bit of light coming through there, and everything. Yeah, exactly. Everything is meant to fit in beautifully so that then with the shoulder you have this full range of movement. You can go in a full circle and twist and go forward and backwards like that. And if it is all perfect, then great, shoulders work wonderfully. But with shoulders especially, if one injury occurs, it is normally a chain reaction, and one thing will affect another thing, which will affect another thing, which will affect another thing, because everything is so tightly knitted together. So with that, when you get the scar tissue developing on just one of those ligaments, as you can see, they all pass over each other in a massive knot. So then that one will go for this one, which will go for this one, which will go for this one, which in turn will restrict around the muscles, which will in turn mean that the muscles are working extra hard to try and do the small amount of movement that they can, which can then even affect the nerves and the blood supply, because the muscles will then constrict around that because they're trying to overwork. And so you can get some sort of unsettling symptoms of feeling a bit numb or a bit tingly or a bit cold in your fingers. So it's shoulders can be difficult. That's why I see so many of them, because it's just do one really small thing and some people go, oh, it was just really silly. I just did this one thing with the tennis racket and then all of a sudden I now can't move my shoulder at all.
I think the shoulder is designed predominantly with increased mobility. So it literally is a great joint for like really big range of movement in multiple different directions and planes. But unfortunately, because of that, you then lose loads of other things. So you've got your lack of stability. So people prone to shoulder dislocations, and then, as you say, things are a lot more tightly packed. So if something happens, it knocks on. And that's kind of the basis of the frozen shoulder, isn't it? When you kind of get maybe a slight injury, you've got the scar tissue, and then you have a chain reaction, and the excess scar tissue that's being laid down is then obviously what causes the problem. Yeah.
So scar tissue is literally just thickening. So it even happens when you break a bone. So if you say you broke a rib, what you may be able to see afterwards is you've actually got a little lump there. Because what will happen is that the bone will go, okay, well, we're going to make sure it's extra strong there and it's weak there. So we're going to build up even more. So when you get that scar tissue, it's just bulking up basically. And if you're bulking up in an area where there's no room to bulk up, it'll cause a few problems.
Yeah, and I think the main thing to say is, because a lot of people do worry about that, because me being a sport therapist, I see a lot of ligament, tendon, muscle problems, and I talk a lot about scar tissue, but there is healthy scar tissue and unhealthy scar tissue. So having the correct treatment, having the right kind of rehab changes all of that scar tissue into nice, good, strong, healthy, and making it stronger. But then on the flip side, if you're leaving things, as we're talking about with the frozen shoulder, to kind of manifest, you're not getting it seen to, you're not doing the right stuff for it, it is just a vicious cycle, and it can take quite a long time then to go.
Yeah, which can be really frustrating for patients, because they'll go, and I don't know if it's the case with you, they'll go, well, how many treatments will this take? How many times do I have to come in and see you? How often do I need to do this before it's better, before I'm all better again? It's basically asking, how long is a piece of string? Different people respond differently to the treatment. It depends on where the scar tissue is. It depends on how you respond. It depends on how bad it is, because one frozen shoulder is not identical to another.
Yeah, I think a lot of the stuff that I say to my patients, it's a lot of education. Look, these are the 3 stages. It's not going to be like a walk in the park. Maybe I'll see you for a couple of weekly sessions or twice a week initially, to just try and get it a bit more comfortable, increase a bit of the movement. But sometimes it's just you have to roll with it. And then I then review them like maybe every 2 or 3 weeks, increase their exercises, because I think then people kind of lose a bit of like the interest and the faith in recovery, but it's purely us as therapists. It's difficult with kind of the pathological part of the injury.
But they lose patience with it, and I think it's frustrating for them as well, because this injury may have been a few months in the making. So they may come and see us after they've had this for 6 months or so, and they've then come to the conclusion, well, this isn't getting better by itself. Normally, when you have a little bit of a niggle, or you feel like you've just been working out really hard at the gym, you don't think, oh, well, I have to go to the therapist. I have to go see someone about this straight away. And it can be a bit difficult to actually come to that realization that, oh, I can't figure this out by myself.
Yeah.
But frozen shoulder in particular does take a long time, unfortunately. Compared to other problems, and please don't compare yourself to another person with frozen shoulder, because it may be different. They may have different areas where it's restricted compared to you. But you can get there, and it's always, and as you said about the education as well, because what you don't want is for it to get worse and worse and worse, because it is that type of injury that will just get tighter and tighter and tighter, and your arm can physically be sort of pulled in like this, and then your options are really limited, because even if you did come in to see someone like myself or you, Jenny, like, okay, well, this is at the end stages, or this is as worse as it can get, and they normally suggest then that you have things like surgery to try and correct it, which is why we always say come in sooner rather than later, because nobody wants to have really extensive surgery on their shoulder, especially if it's with their writing hand.
Of course. So that kind of leads quite nicely onto treatments, and maybe some home exercises that we can give to people who are watching. For me, the initial stages, when you come in, if you've got a lack of movement, obviously the main thing that we need to do is increase the movement. I think you were talking to me about some different mobilizing techniques that you do in the session.
Yeah. So when somebody comes in to see me, I try to make sure that, because they normally have that characteristic of using their entire shoulder complex rather than just using this shoulder joint right here, which we call the glenohumeral joint. What I try to do is I really try and compress all this down and just get that movement going through that joint there, so that finally you get some movement going through there. You also want to, like we said, there are 3 different bones. So you get the shoulder blade, got the humerus, and you've got the clavicle. So then I also try to improve the movement between the humerus and the shoulder blade and the clavicle as well, so through this joint right in here. And then we also try to do something called traction, which is literally just going pulling, gentle pulling. I wouldn't do that at home, just getting, your wife or your neighbor or a friend to just pull at your arm. It's very, very controlled, and we're always feeling how much you can go in one direction compared to another. But just try to stretch out some of those ligaments and also allow some fluid to flow through the joint as well.
Yeah, I do as well. Quite a lot of mobilizing, and I do it, as you say, a lot of traction stuff to really try and open up and stretch the joint. Obviously, massage is really good as well in the initial stages because everything is just so tight and overworked, and there's muscles being used a lot more because they're compensating. And I think it is, as you say, just kind of retraining the brain a bit sometimes, because if the last like 4 months you've been moving to lift your arm like this, using more like your trapezius muscles, then it's about retraining kind of that movement pattern to keep that depressed, as you say, and that can be very time consuming, and people can find that really difficult. But I think once you've kind of got that, and then starting off some range of movement stuff at home to try and push it yourself, I would say people are usually well on their way with what they need to do.
Yeah. There are specific muscles that you can really try and work on. So I always try to stretch through the pectoral, really big muscle, really, really strong muscle. So those are just stretches that you can do at home. Again, I don't do them too much. Move like this, stretching through there. You can even stretch through the bicep with a straight arm through there. You can work through some of the rotator cuff, which is the big muscles that are on your shoulder blade. Most people have heard of the rotator cuff, but they are the ones that predominantly do the most shoulder movement. So you really want to work through those. So if you can get your arm up to try and stretch through there, then do. If you can't, you can do a technique which Stephen really advocates, and I've seen him do. You can get a metal spoon. Sometimes you might want to put a bit of cream on it. Depends how much friction you want. Or you are. What you can do is physically get a spoon and go down that side through there to try and do a little bit of self massage through there, because it's quite difficult to massage.
Yeah, it's a sensitive area as well, isn't it?
Yeah, and especially if you're a bit ticklish, then it's not fun getting somebody else to do it for you. And then, of course, it's a classic tennis ball against your shoulder blade. It's just gentle massage that you can do that, or it will help. It may be sensitive, and if it hurts, stop doing it.
Yeah.
But there are small things that you can try and do at home. I don't know about you, but I really like patients trying to do the pendulum technique.
Yes, I was just going to say that. Actually, you were saying that with the traction, getting maybe people to pull that, like not pull their arm at home. This is something that they can do kind of on their own in a controlled way. I can demonstrate. I think usually what is good is to maybe have like a small weight in your hand, or like a tin of beans. Hold on to maybe a back of a chair or a table, and you just want to let the arm go really heavy and let it just swing around. And what that's doing, as you say, Sophie, is distracting the joint. Yeah, I give that one a lot. People find that really relaxing.
Yeah, they do.
Really soothing to the area.
Yeah, even after a really long day at work, sometimes we really just want to stretch through the arms, and that was actually quite nice because, again, it just opens up the joint to allow the fluid to flow through there, to allow all the nerves to open up nicely, to allow the blood flow nicely through there, and it just feels quite nice. That's
nice. I would say the only thing that I would add into those home exercise programs is range of movement stuff that you can kind of use different parts of your home and have a bit of fun trying to work out how you can try to increase your movement. With frozen shoulder, a little bit of discomfort is okay. I would say. I don't know about you. To really make a difference in the movement. So I usually say if you've got like a broomstick at home, maybe using your good arm, holding onto the broomstick, using your good arm to pull up the bad arm to just try and force that movement. A lot of people kind of try to walk their hands up a wall, or try and like hold on to tops of doors and things like that. So anything where you can try and increase your range of movement, obviously safely, because I have had some patients who come in and they've told me crazy things that they do. That's great. Usually the broomstick one is, I find, works the best.
Yeah.
Do you love those?
Yep. So I also advocate, and some patients are just, oh, don't fancy doing that one. But if you do, doing a bit of cleaning. So if you have a nice big table or something, then what you can do is you can get a cloth, circular movements, stretching forward, cleaning, those circular movements, and then you get some dusting done as well. So, you know, it's multitasking.
It's a win-win.
Exactly.
Yeah. Okay, so I think that's kind of our top tips on, if you are struggling, make sure you don't just leave it. Make sure you come in as soon as you realize it is an actual problem. I think everyone has that mindset of, let's just leave it a week. I probably just tweaked it, let's leave it a week. If you keep saying that every week, it's then a month and 2 months. So yes, maybe leaving it a week to see if it settles could potentially be okay, but then saying, no, a week's gone by now, it's not better, let's go get this sorted. As you say, its shoulders can be a nightmare. So I think that's the first main point. And then obviously we've got the exercise tips to do at home.
Exactly. You know, trying a bit of heat and cold on the area as well, I don't have a problem with. You know, it's just managing at home, you know, doing things that, and like we said, it's a long process. So it's just finding things that you can do and that you like doing as well.
Yeah.
It's quite difficult when you're prescribing lots and lots of things for people to do, and they're just like, oh, I just don't get along with it. And it's experimenting, and there are lots of things that you can do with shoulders to try and figure out what works best for you and what doesn't. So we'll always suggest lots of different things for you to do. We're not going to just do this sort of one treatment plan of, okay, well, these are the list of things that you should do. You have to do all of those ones, because people aren't like that. People don't.
No, yeah, of course. I think, well, me personally, I talk a lot about people's lives, and we try and work out where we can fit these things into their everyday lives, because this isn't going to be just 3 or 4 weeks of treatment. It's going to be probably at least, I don't know, a couple of months, maybe a year or so. So it's just making sure these exercises need to be done and need to be done quite consistently, quite a lot. So we kind of think about, okay, right, how can we get your range of movement? Okay, you're brushing your teeth, you've got a high shelf in front of you. Why don't, whilst you brush your teeth, you're trying to lift up and hook yourself on that shelf? Kind of things like that, so that it doesn't feel like it's a chore. A lot of people think, oh, I need to take 10-15 minutes out of my morning or my evening to do my exercises. No. Unfortunately, with the frozen shoulder, it's something that you have to commit quite a lot of time to most days.
Because just seeing me or you for half an hour a week, unfortunately, will not solve the problem in a month. No, it is a long-term issue, which takes a lot of effort on both your side and our side as well. Because again, like we're putting a lot of work in, because like we said, these are frozen, they do not want to move. So us trying to force these things to move can actually take a lot of effort and energy on our part. But also, if we want to work on your goals as well. The fact that it bothers you when you're trying to reach the serial, that's not a big deal for you. But the fact that you can't do your golf swing, so we're going to really try and work on that movement in particular, to just try and get you back to doing that, something that you really love. Because if just reaching the serial doesn't really bother you, then us focusing on that goal won't be helpful for you. So it's just trying to figure out what works best for you.
Yeah, and I think to kind of finish off, yes, everyone hates frozen shoulders when they have them. Yes, frozen shoulders are a nightmare, and when we get patients coming in and they think they've got a frozen shoulder, it can kind of feel very overwhelming. But I think the key take-homes are, there are exercises that you can crack on with at home, and it will resolve. it will resolve. It's just giving it the time.
Yeah, basically.
Perfect. Lovely. So if you do have any questions, or you kind of want to pick mine or Sophie's brains, then just comment below and we'll get back to you. But if you are struggling, or if you have noticed that you've had a niggle for a week, 2 weeks, a month, 2 months, pick up the phone, give us a call, or book in with one of us and we can start that ball rolling.
Exactly.
Lovely.